joining us today. I'm Teresa Marentette, CEO of the Windsor-Essex County Health Unit. We wanted to let you know that we continue to receive your questions, and the media have done a great job bringing your questions to us. Moving forward, we will attempt to answer a couple of common questions each day in our updates. I will start with our daily updates. We now have 7,437 confirmed cases of COVID-19 in Canada and 1,706 cases in Ontario. Chatham-Kent has 6 cases and Sarnia-Lambton has 28 cases. Michigan now has 6,498 cases with 1,801 cases in Detroit. To date, we have 65 confirmed cases of COVID-19 in Windsor-Essex. The health unit follows up directly with everyone who has tested for COVID-19, both positive and negative results. Those that are awaiting results are to remain in isolation. If you have tested negative for COVID-19, you must remain in self-isolation for the remainder of the 14 days. Due to the increasing volume of positive test results, we will no longer be providing specific details on each case. However, 50% of our cases are male and 50% are female. 30% of the cases are between the ages of 50 and 59. Overall, 1,052 individuals have been tested for COVID-19 in Windsor-Essex, and of those tested, 330 tests are pending. Testing for COVID-19 should be based on clinical assessment. All specimens submitted will be tested. Where there are shortages of testing kits, then the following groups will be prioritized for testing: symptomatic healthcare workers and staff who work in healthcare facilities, symptomatic residents and staff in long-term care facilities and retirement homes, hospitalized patients admitted with respiratory symptoms, symptomatic members of remote, isolated, rural, and/or Indigenous communities, and symptomatic travelers identified at a point of entry to Canada. Please continue to visit WECHU.org for the most current information and case counts. If you have traveled outside of Canada and are feeling unwell and need to seek a health assessment for COVID-19, there are 3 options available. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, or call your primary health care provider for a phone assessment or a virtual assessment if that is available. They will guide you for next steps, including contacting public health or attending an assessment center. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. As we are clearing the backlog of pending cases, as we mentioned, our case count now stands at 65. We're still waiting to analyze the additional details on some of these new cases. I'll go through the questions that we've received from our audience for quite some time. So first question was, can I go outside? And the response to that, if you are asked to self-isolate, please do not go outside. If you're staying home as recommended for precautions but have no symptoms, you can go outside, but you can limit your trips to ensure that you are practicing physical distancing and always maintaining 2-meter distance from yourself and others. The second question we received, how do you isolate in an apartment building or in the same house? Does everyone have to self-isolate? The response to that is, if you are self-isolating and you live in an apartment, it does not apply to the entire building. People in self-isolation should stay in their apartment and avoid going outdoors. Arrange for food and essential items to be delivered to your doorstep and avoid interaction with others. The same can be said for people living in the same house. If one person in the house is under self-isolation, they should sleep in a separate room, and if possible, use a separate bathroom and maintain 2 meters distance from others in the house. Regular cleaning and sanitizing of shared spaces is important in those cases. I'll now move on to our regular updates, and as promised yesterday, I will provide a summary of the cases as we have seen until yesterday. The epi-summary do not include the data on the new cases we just reported on this morning. 20% of the cases what we have seen in Windsor-Essex are a result of possible community transmission, which is essentially saying that there is no travel link identified in those cases. So 20% of those cases are as a result of that. there are a number of people, almost 80% of these individuals have traveled outside of our region. And when we are further breaking it down, 2/3 of these cases have a travel history to Michigan. At least 1/3 of all cases that we have seen are in healthcare workers, and all except one are healthcare worker in Michigan. We do not have case detail on 13 individuals, so the data that I just summarized, it's for those who we have an answer for the response answer for the healthcare worker. Among those who are sick right now, 20% of these cases are hospitalized, and the rest are recovering well in their home. Based on the epi-summary, there are two important considerations. First is possible community transmission, as we are seeing in 20% of these cases, and the issue of healthcare worker and high number of confirmed cases in that group. As much as I appreciate the work of my healthcare colleague in their response for COVID-19, they are at the forefront. They take their job seriously with full devotion and take all risk to care for their patient. That is why it is extremely important for us to protect them and from contracting the disease in the first place. And if they do contract, we have to take action to limit and spread to other vulnerable population in the hospitals. We should have a good system in place to prevent them from spreading the disease to their family and to their patients. Michigan is becoming a hotspot for COVID-19 as the number of cases continue to rise. And in Detroit, the number of cases is more than the number of cases in all of Ontario. This is a concern for all of us. This is a concern for me and my community. Every time someone is crossing the border and coming in my community is potentially increasing the risk of COVID-19 in our area. We have strong measures in place to restrict travel. Even our recommendations to our community is to stay home and go out only when it's needed. On the same analogy, we should be looking at the possibility of limiting these cross-border travels whenever it's possible. If someone must travel, they should be self-isolating them upon their arrival at their home and do not expose anyone in their family. Do not go outside, do not do anything to prevent any direct or indirect spread of COVID-19 in our community. Given the number of cases that are rising at an alarming rate in Michigan, the measures that are currently in place by all levels of government in Canada to flatten the curve may not work if our Windsor-Essex, if we do not limit cross-border travel. We hope to work with federal and provincial governments to discuss cross-border issues related to essential travel and in particular healthcare workers to limit the spread of COVID-19 in our community. Thank you. We have a response whether they are a healthcare worker or not. 1/3 of those cases are healthcare worker, and all except one are healthcare worker who work in Michigan.
Which I guess goes in line with what we're seeing in Michigan.
That is correct. Michigan has a high number of cases, so we expect to see a higher number of cases who are a travel history to Michigan.
Of the 20% that are hospitalized, do you have any idea about the condition? Are they critical? Are they on a ventilator?
So what we know, 3 of them are in ICU, and the rest are in wards and being managed by their by the physicians there.
Thank you.
We'll take a question from Blackburn News.
Now that we have evidence of community transmission, is there any further steps that need to be taken in your view?
Well, absolutely. I think the first and foremost important part is people should follow those recommendations of physical distancing. I think it is very critical now when we are talking about community transmission. So potentially anyone you are coming in contact with could be a case of COVID-19. And in order to protect yourself and in order to prevent and limit the spread of COVID-19, you must maintain that physical distance. When you are out and about, making sure that you're washing your hands frequent and often, and when you are, just limit your travel outside. Like if you don't have to be outside, just don't go outside. And if you have to go, do your work and come back as soon as you can. And even when you're out there, please maintain your physical distance of at least 2 meters.
Question from the Windsor Star.
Dr. Ahmed, you mentioned yesterday that we are entering a critical time in terms of our fight against COVID-19. In terms of the infection curve, when do you expect it to peak?
Well, it's hard to say when we will expect to see the peak, but the number of cases that we have seen in the last couple of days are a result of the backlog that is currently being cleared right now. So it may give us an indication that something is happening right now. It may not be the case. So we will look into it. The data from this week, the individuals who are tested this week or who have developed symptoms this week would give us a better indication of where we are heading with respect to this curve. But across Canada, then this week and the next week is identified as the crucial time to see if all those measures that are currently put in place by all levels of government, are they working? Do we need to do more? If you see even our Premier's direction yesterday, limiting the number of people gathering at one place is less than 5 now. So I think those are all strong measures that are put in place and reinforced by all levels of government to ensure that we do take care of these, we do stop the spread. The more action that is taken right now, it will help us in the long run in preventing increase in number of COVID cases. So we are hoping that all of these measures should help us in getting through this quickly. But this week and the next week would be the most crucial week for our community and also across Canada.
Last night, the government of Ontario extended the emergency order to close all public playground facilities, recreation facilities, and parks. What comment could you make on that regarding the vaccine community?
So what we can see clearly, the intention of this government is to make sure that people are following those social physical distancing measures, and there is this opportunity for us to recognize that there are limited activities that people should be engaged in when they're outside. There's strong recommendations especially for people who are immunocompromised, who have chronic conditions, or who are elderly, to stay home and do not go outside at all, period. But limiting access to some of these additional facilities will also help people to stay home, basically, and that's what everyone is looking for: people to stay home, maintain physical distancing, and try to flatten the curve as much as possible.
Thank you.
Question from Windsor-Essex.ca.
Just a clarification on the statistics you gave earlier. Does that apply to all of the 65 cases or just the 44 total from yesterday?
That is just for 44 from yesterday. We will add more details to it as we continue to work. The new cases that we have received, where we are at a different stage of data collection, and that won't be accurate to include this in our epi summary for today.
Okay, thank you.
Question from CTV.
So, Doctor, you were talking about the frontline healthcare workers in the U.S. and how it's getting out of hand on that side of the border. Are there any measures? Sorry, better yet, is there fear? I guess on this side of the border for the frontline workers working at the hospitals, and what kind of suggestions would you give to them?
So we started this conversation with our hospital colleagues to try and restrict our staff movement from, especially if they're working in Michigan and also in Windsor-Essex, and what can be done to limit that. We recognize that our healthcare workers are really professionals, and they are at the forefront. They take their job seriously. They want to help people, even people who are traveling every day. They know the risk, what they're putting themselves into, but they have a professional obligation as well to go and serve those people. So there is no disagreement on that part. I think those are important people and they are doing that work. What we are looking for is when we're talking about increasing the risk to the community, because all those measures that we are currently taking right now is to decrease that risk. Any measure that can put our community at a higher risk, I think we should be looking at it again. Some of the recommendations we have made is if people can stay in one side of the border, that's great. That should be the way. If not, then what else we can do? There are some recommendations to maybe just do a home work self-isolation. So if someone who lives here in our community and crossing the border and working there, and then they're coming back. So basically what we are saying is, if you're coming back, basically you're just self-isolating. You are not going outside. You shouldn't go outside for anything. So basically now your home and your workplace, nothing in between. So that would help to limit at least some of the spread if they are out about in our community. So basically then we're reducing that limit, that spread. But even just the number of people who are crossing, do all of them have to cross? Do all of them have to cross every day? So I think those are the questions that we have to look at, and we need to recognize that this is a fight that everyone is fighting together, whether it's Michigan, whether it's us, we are all in this together. Anything that goes wrong in Michigan, it has an impact on us. Anything that goes wrong here, it'll have an impact on Michigan. So I think it's the time when we have to think about how do we support each other, but also how do we reduce the risk to our community, our respective community, in the best possible way.
Okay, so I mean, I heard yesterday and even the other day too, where we're going to have between 300 and 350 beds available, right? So if this continues to spread and grow, which we anticipate, those beds will or could get filled. Are those workers? I guess that's where I'm going. Are we worried about those workers like we are worried about the workers that are working the front lines in the States?
Well, this is always the risk, and I think that's what we have seen in cities that have seen a huge increase in cases of COVID-19. Whether you're talking about New York, whether you're talking about China, whether you're talking about any other countries, the healthcare workers are impacted by it because they are the ones who are providing those care, and they use all those PPEs, but still the risk of them contracting it is much bigger than anyone else who's out about in the community. And so there would be that concern, and we have to recognize that if a healthcare worker or the number of healthcare workers, if they get sick, it can have two effects. One is they can spread it to other people in the hospital, which is a problem, and the second effect would be when they're sick, basically now they're out of the workforce, and now you have less people to care for the sick people in the hospital, and it would be a very like a resource problem for the hospital to even keep the services open. It's not an easy answer. There's no easy solution to it, but I think we need to try and minimize as much as possible by taking some of those proactive measures. We know most of the hospitals are actively screening for their staff. They're asking all those questions. They're monitoring to make sure that if they develop any symptoms, they can just keep them self-isolated or make them stay at home. So all those measures are in place. But despite all that, we know that it is possible. So I think what we need to look at all these opportunities that we can to try and limit the spread either in our community, in the healthcare workers, through cross-border, everything. So I think we need to look at it as a comprehensive solution, and that's what we're trying to do.
And questions from CBC?
I have another question about the border. I'm just wondering if there are any specific restrictions that you are advocating for to limit crossings at the border. For example, temperature screenings, longer questionnaires, things like that. Is there anything specific you'd like to see there?
So I think, good question. What we can take temperatures, we can talk about the screening. I think most of the healthcare facilities are, especially if they're critical workers, some of them are monitoring their temperatures actively. They have all those screening questionnaires. So adding another layer may not necessarily help in that sense. But what I think could be helpful is just maybe just limiting the number of travel and transmission, and more specifically, if some of these healthcare workers are working on multiple sites, what can be done to maybe just try and minimize their movements from someone who's working in Michigan and also works in Windsor? Can we stop that kind of travel? If people are going, let's say, 3 times a week or maybe every day to Michigan, can they just go maybe once and then stay there and then come back maybe the end of the weekend or something, just to limit that movement and as much as possible. And the second recommendation which we asked about is maybe like a work-home isolation. So when they're at work, when they're coming back, they're just isolating themselves. They're not going outside. So I think these are some of the ways that we can look at. every business is now adapting to do things differently, and healthcare sector is no different than that. So I think there's still a lot to learn, and there's still a better way to find solution to some of these problems, and we hope that we'll look at ways, creative ways to still get the human resources that we need to maintain our operations, but also not compromising on the community safety.
Just as a follow-up, I'm wondering whose responsibility is it ultimately? You said you're hoping to work with federal and provincial governments to look at these limitations as possible, but is it the government? Is it the employer? Who ultimately has to help limit these crossings?
So I think all of us have a little bit of role in solving this problem. So obviously anything that's coming from the federal government has the jurisdiction of who's crossing the border and who's not. So right now the border is allowing those essential workers to cross, which is understandable. From an employer perspective, they need those people, understandable, but having some measures in place to ensure that they are actively screened, having measures in place to make sure that they're not crossing border or they're not traveling frequently. From a community perspective, when we're talking about work-home isolation piece, so that's something that we can try and make recommendations on that. So I think there's a role for every stakeholder that is involved, whether it's the government, whether it's the employer, whether it's the individual themselves. And we like to see everyone working together for the same cause, and only that way we can get through.
Thank you.
Any other questions?
Just a couple.
Okay.
I guess so.
How would I go ahead?
Okay, who?
Oh, Dr. Ahmed?
Okay, Nelson?
Yeah, sure. So Dr. Ahmed, just to follow on what you just spoke about, the Quarantine Act currently makes an exemption for healthcare workers, so they're exempt from the 14 days isolation. Would you like to see that reversed? Are you saying that you don't want that to happen?
Well, as I said,
You'd rather that it be mandatory?
well, as I said, it's we'll have to look at all the options that are important, and recognizing that we cannot fight this war without having healthcare workers on the ground. This is almost something that is very critical to contain the disease in those acute care hospitals. So I think if we just outright ban all of that, it may have an implication. Not saying that that's the perfect solution, but we need to find ways that, okay, what else can be done, and if these workers can be mandated, can be made, maybe have to travel less often. I think those are some of the measures that we can think. We don't want to take away all these important healthcare workers from any hospitals. Nobody would want that, and I think it is, especially in this time around, everyone is looking at their role. The governments or the provinces expanding the role of the nurses to physicians to allow them to provide care to those people who need support to fight this COVID-19. So I think the solution is much more complicated than just putting an outright ban and saying that nobody's traveling. I think we need to look at range of options, that how we can support that, and also how we can protect our community.
Thank you.
Teresina?
Yeah, just somebody actually just texted me while we were here. The positive cases locally, do you know if they're Windsor, Essex County, where in Essex County? Do you have a breakdown of where those residents are, or no?
So right now we're just reporting it's in Windsor and Essex County, so it's combined all together. I think it really doesn't make a difference. We don't want to give any false sense of security or unsecurity to people that we are safe or others are more at risk. The risk is everywhere. Everywhere you're going, everywhere you're interacting, there is a risk. People should be following the physical distancing piece and doing everything what is recommended to them to prevent and limit the spread of COVID-19.
Thank you.
And I have one more question if I can jump in. We've been hearing reports that Detroit might be getting its hands on spot testing kits, and I'm just wondering if that is something that we might be able to get ourselves here.
are they getting? Can you please repeat?
On the spot testing kits is how they're being described, and I don't know if there's anything similar floating around on our side of the border.
So you're referring to point of care testing to test for people for COVID-19. None of those test kits are approved in Canada at this point. We heard FDA approved a test kit in US for point of care tests. We really have to be careful in the validity of those testing. Is there any risk for having a false positive or false negative? And then those are the kits that can be used out in the field. We would like to see something like that because it would really speed up some of that process of testing individuals right on the spot and getting an answer. But none of those point of care tests are currently approved in Canada.
Okay, thank you very much.
Any other questions?
I have one more. You're talking about for healthcare workers in Michigan, the whole kind of isolation, just go to work, just go home, nowhere in between. Is that also kind of what you're hoping for healthcare workers who work in Windsor as well?
Well, I think that's better for the community and also better for their family as well. And I think we should be treating this issue as affecting everyone. And when we're talking about Michigan and Windsor, basically we're all connected. We have so many people who are commuting daily. We have so many commonalities. Whatever is impacting them, it's also impacting us. So I think we should be treating our workers exactly the same way as much as possible, and try to do everything we can to prevent and limit the spread of COVID-19.
Thank you, everyone.
Thank you. Bye-bye.
Thank you.